O positive is the most common blood type in the world and is found in almost 4 out of every 10 people. The most important aspect of this group is its prevalence. 1 unit of O positive blood can be given to anyone who is Rh positive, regardless of whether the recipient is A, B, AB, or O. For this reason, in emergency situations, doctors primarily prefer this blood type to stabilize most patients. Additionally, its abundance means that blood banks rely heavily on O-positive donors to sustain hospitals' needs. From an evolutionary perspective, blood type O has affected human survival chances in various ways. The absence of A and B antigens reduces the risk of severe malaria by making it difficult for the Plasmodium falciparum parasite, which causes deadly malaria, to clump red blood cells together. According to anthropologists, this characteristic may have provided an advantage in hunter-gatherer communities, as these societies' immune and digestive systems were more resistant to environmental conditions and protein-heavy diets. Long before the emergence of agricultural societies, humans had developed resistance to wild pathogens. However, the H antigen present in group O can serve as a gateway for some microorganisms. Therefore, individuals with blood type O may experience more severe courses in diseases such as cholera and norovirus. Additionally, in blood type O, some clotting components, such as von Willebrand factor, which plays a role in clot formation, are found at lower levels. While this situation prevents the formation of potentially life-threatening clots, it can sometimes also increase bleeding risk. A positive is the second most common group worldwide and is found in approximately 3 out of every 10 people. The characteristic of this group is the A antigen and Rhd factor on the surface of red blood cells. Thanks to this, A-positive individuals can safely receive blood from both A and O-positive donors. Medically, this situation provides a wide compatibility range, making a positive blood one of the easiest groups to manage in hospitals. Due to its high frequency, blood banks can maintain regular stocks for emergencies. Beyond its medical significance, Type A carries some evolutionary and immunity-related characteristics that have influenced humanity's adaptation process to the environment throughout history. The A antigen is thought to be associated with stronger immune responses against certain bacterial infections, particularly in crowded agricultural communities with poor hygiene conditions. This situation may explain the increase in prevalence of Type A with the transition from nomadic hunter-gatherer societies to settled agriculture. However, the same antigen has also been associated with susceptibility to clotting disorders and some cardiovascular diseases, thus demonstrating the balance between evolutionary advantage and vulnerability. B positive is found in approximately 10% of the world's population and is therefore not as common as O and A, yet it still has a significant proportion. It is defined by the presence of B antigen and Rhd factor on red blood cells. B-positive individuals can receive blood from B-positive, B-negative, O-positive, and O-negative groups, which provides moderate compatibility. However, its lower prevalence requires more targeted campaigns to collect sufficient donations. From an evolutionary perspective, Type B has a striking geographical distribution. Its higher concentration in certain regions of Asia and the Middle East suggests that population movements and selection pressures throughout history may have influenced this distribution. Research reveals that the B antigen provides protection against some infections while increasing sensitivity to others. Additionally, studies related to metabolism show differences in carbohydrate and fat processing. This demonstrates that blood types are not merely transfusion categories, but carry traces of human evolution. AB positive is found in less than 5% of the world's population and is the rarest major positive blood group. It is defined by the presence of A and B antigens as well as the Rhd factor on red blood cells. This complete antigen combination allows AB positive individuals to receive blood from all major groups, whether positive or negative, making them universal recipients. This is a great advantage when blood supply is limited or rapid compatibility is needed. Scientific research argues that AB is the youngest blood type, and emerged only a few thousand years ago from the combination of groups A and B. Its rarity makes it valuable for genetic diversity studies. However, the antigens that provide broad transfusion compatibility are also linked to increased risk of clotting and vascular diseases. For this reason, AB positive is considered an unusual evolutionary intersection point of rarity and advantage. O negative, despite being found in less than 7% of the world's population, is one of the most critical blood types in medicine. Because none of the A, B, and rhD antigens are present on the surface of red blood cells, it can be transfused to anyone regardless of blood type and is therefore extremely valuable. It is known as the universal donor and is the first choice in emergency rooms when there is no time for blood type testing. Evolutionarily, the rarity of O negative demonstrates how unusual it is to have none of the major antigens. However, this situation may also explain why those with type O are more susceptible to severe cholera and norovirus infections. The absence of the rhD factor requires special monitoring for newborn hemolytic disease in O-negative mothers. Nevertheless, O-negative individuals hold unique importance for the global blood supply and are seen as silent guardians of healthcare systems. A negative is found in less than 2% of the world's population and is among the rare groups. A negative red blood cells carry the A antigen but lack the rhD factor. Therefore, recipients can only receive blood from A negative and O negative donors. In clinical practice, this rarity makes A negative blood donations very valuable. From an evolutionary perspective, the A antigen is associated with strong immune responses against certain bacterial infections, but Rh deficiency can pose risks during pregnancy. If an Rh negative mother carries an Rh positive baby, the immune system can damage the baby's red cells. Modern medicine controls this problem with preventive measures, but in the past, this situation had effects on reproduction and survival. B negative is a very rare group found in only 1% of the world's population. Red blood cells contain B antigens but lack the AHD factor. Therefore, blood can only be received from B negative and O negative donors, which quite severely limits transfusion options. Hospitals must manage this blood meticulously. Type B has not been distributed equally throughout history. Its more frequent occurrence in some Asian regions and rarer presence in Africa and Europe explains this distribution. rhD deficiency has narrowed its spread even further. Research reveals that Group B shows different immune responses to certain bacteria and viruses, reflecting the subtlety of evolutionary balance. AB negative is the rarest of the 8 major blood groups and is found in less than 0.5% of the world's population. Although both A and B antigens are present on red blood cells, HD is absent. This combination makes it extremely rare. AB negative plasma is very important in transfusion because it can be given to recipients of any group. Therefore, it is the universal plasma donor. However, AB negative red blood cells are also very rare and can only be obtained from a limited donor pool. From an evolutionary perspective, AB is thought to be the youngest group and is accepted to have emerged as a result of the combination of A and B. HD deficiency makes it even rarer. From a genetic standpoint, AB negative represents a biological exception in the human population and has unique value for transfusion medicine. It is like a biological signature standing at the extreme end of human diversity. Watch the world, subscribe, and understand.